Thank you very much. And it's such a pleasure to be here to speak with you all. And of course, my colleague, Manal, and, following in her footsteps, hopefully I can add some more value. But I think she did just an amazing job at covering. I think what I'm going to be talking about is sort of from a foundation perspective, how we're integrating place, power, community input, organizing, dealing with policies and systems change, and underpinning of historical legacies such as racism and structural inequities that really are deep root causes of and barriers for communities to thrive. So I have 3 points that I would like to make. One, why place matters, theory of change, and then talk a little bit about local progress and successes here in California. So the mission of the California Endowment is to expand access to affordable quality healthcare for underserved individuals. Now this second part of our mission is actually where we really punch a hole to address social determinants of health and health equity, which is and communities to promote fundamental improvements in the health status of all Californians. As you've heard already, that health does not equal healthcare. And I think at the California Endowment, we're 20 years old, so we're kind of new on the block compared to others. But what we've learned over this time is that where you live matters, and it matters a lot. So through our work, we've conducted several studies and research on disadvantaged communities in California. And if you begin to look at just, let's say, 75 of the administrative data that's available to anyone, whether it's graduation rates, job opportunity, et cetera, about 100 zip codes pop up in California. And as a result of this, through the California Endowment, we selected and shifted our priorities to look at place-based strategies. But before I move there, whoops, let me go back here. Sorry about this. So let's cue up the video, which I'd like you to all see.
What determines how long we'll live? Is it what we do? Is it who we are? Actually, when it comes to predicting how long you'll live, your zip code is more important than your genetic code. Here's how this works. Meet Deb and Maria. They both have jobs, they're around the same age, they're both married, and they both have 2 kids. Deb lives in A-Town, while Maria lives in B-ville, less than 1 mile away. They're similar in so many ways, but here's the thing. On average, residents of B-ville will die more than 15 years sooner than the residents of A-Town. Why? Because where you live is about more than just your address. It's about your opportunities. For example, Deb and Maria's access to healthy options is really different. In A-Town, Deb's family is surrounded by healthy food options, including farmers markets, specialty shops, and grocery stores. The air in A-Town is cleaner and fresher, and there are lots of safe, clean parks where Deb can exercise and her children can play. A-Town has good public schools for Deb's kids and easy access to emergency and preventive health care. On the other hand, B-ville has broken, badly lit sidewalks, and the parks are unsafe. The air is filled with truck exhausts from the nearby highway. And for food options, Maria's only choices are B-ville's many liquor stores, fast food places, or convenience stores. The schools in B-ville are overcrowded and undersupported. And even if Maria can get her kids into better schools far away, she needs to figure out how to get them there without access to a car. So for Maria, having to juggle so much to find healthy options can be an overwhelming source of chronic stress, which is a serious health risk factor. In fact, For all the residents of Beeville, chronic stress drives health problems like obesity, diabetes, asthma, and heart disease. How did A-Town and Beeville get so different? Well, in many cases in cities and towns across California, the root cause was racial and economic discrimination. Over the generations, poor white people and people of color were pushed to less desirable parts of town. Where banks refused to lend money, businesses left, jobs too, schools declined, and the neighborhood crumbled. Everyone who could move away did. And what's more, when communities like A-Town and Beeville are so unequal, Beeville isn't the only one that suffers. Because it turns out that not only is your zip code a predictor of how long you'll live, so is what country you live in. Countries with the greatest income inequality have the lowest life expectancy. So even Americans like Deb, who are white, insured, college-educated, and upper income, die younger than their peers in other countries. In fact, our life expectancy is 43rd in the world, and that number is slipping. In the end, our biggest health risk may actually be inequality, and extreme inequality hurts us all. So what do we do? Well, if we're all going to be healthier, we don't just need to help the folks in Beeville beat the odds. We need to change the odds for everyone. And that's what we're doing. There's a movement happening. We're Californians. We don't follow. We lead. We are building the power to make health happen in communities across the state. We are coming together to build one California, a smarter, more inclusive and equitable state that creates health and opportunity for all of us. Join us. To learn more, visit buildinghealthycommunities.org.
So as you can imagine, for public health advocates to talk about the social determinants of health and health equity is an enormous challenge. And describing the work of systemic racism and change that's needed in our society and to have that conversation is also a challenge. So what we've learned through our work is that it's important to use multi-modes of communication. And how do we spread it beyond the typical and usual audience? How do we really create this greater shared understanding and vision and connection where others see that their desire and will is for a more inclusive society so that all can benefit? So I'm going to turn now to a report that was commissioned by several philanthropic organizations here in California, the Portrait of California. So many of you are probably familiar with the Human Development Index, but again, this sort of adds credence as to this income inequality and the growing inequality in so many ways in California. There is a large body of evidence. California Portrait is available online for many of you if you would like to look at this. We know that some counties in California have created their own index to be able to look at inequities in their region and address through a governing through racial equity lens of how to begin to get systems to better align and focus on improving health. So the main takeaway from this slide is what I have boxed in blue. So if you begin to look at the 1% in California, the health index shows that 9.8 overall index number. So if you look at the other columns, life expectancy, child poverty, median household income, and population size, and then you go down when you look at struggling California, what the authors of Measure America really pointed out is that there's 5 Californians. There's 5 different characteristics. And so how do you begin to understand that through particular data? So when you begin to look at the bottom quadrant, struggling California, you look at the life expectancy, child poverty rates, median household incomes, and then if you look at the population size, it really pops. And then when you begin to look at disenfranchised California, which is about 5 communities in California, you begin to see further disparity there. So what Measure America has done is really prove that, again, that place matters. And for the California Endowment, taking all of this information in, over 9 years ago, I've been with the foundation for 9 years, but it's been about a 10-year process to really think through, with all the learnings that we had funded over 35 different strategies that look at healthcare access, systems change, cultural competency, housing, training physicians for cultural competency. I mean, a whole host of strategies. And we realized that we were not really having effective change in California. And then we moved to this place-based strategy that we call building healthy communities. And for a foundation of our size to focus on a community for 10 years, it's a pretty big deal to get the board, as well as other leaderships to be behind this change. We're now 5 years into building healthy communities. We selected our sites based on several quantitative and qualitative indicators. These are the communities, both rural, urban, and suburban communities that we've selected. It's approximately $1 billion investment over the 10 years. And I will talk a little bit more about our strategies. So when we think about our theory of change and think about the prominent paradigm, we think about the medical model and focusing on behavior, disease, and death. When we think of the socio-ecological theory, we're thinking of bias, policies and practices, neglected communities. When it comes to death, we think about emergency rooms. Disease, we think of clinics in terms of how we impact it. Behavior, it's health education. When addressing neglected communities, what we've understood is that we need to really change this paradigm and have a deep understanding of it, that how do we begin to build power in place, and I believe some of the other presenters talked about that. How to strengthen the muscle around policy advocacy, and how to change the narrative on communities. As mentioned in that video, when we think about, again, these issues of race and racism and structural issues that impact communities, it's a very difficult topic today for our nation to sort of address those issues. So we really feel at the California Endowment that we need to really increase inclusion. And how do we begin to talk about and changing the narrative about an inclusive community? And what does it mean to belong to a community? You know, why would a public health trained person begin to talk about belonging? Belonging is so critical. If you think about where you live in your community or where you grew up, and you have that moment of reflection, of remembering, that remembering of where you came from is incredibly powerful. So belonging and inclusion of difference in a community is it's incredibly linked to improving outcomes for communities. We think the health in all policies approach, and I think as Manal pointed out, the built environment absolutely critical. In our work at the California Endowment, prior to building healthy communities, I can assure you we funded very little when it came to education. We saw ourselves as a health funder in the traditional sense. We did not fund much in the juvenile justice system. We did not use our programmatic related investments in a way to address and spark supermarkets in low-income communities, nor did we fund affordable housing. So really thinking about a health in all policies approach is one that we've really learned not only from the literature and the data, but I would have to say quite humbly from communities themselves and pointing out systems that are not working for them. And then when we think about all of these things, what does it mean to build on the resiliency and the transformation of communities? So in our theory of change, in terms of our practice, we call them sort of 5 drivers of change. People power, youth leadership, development and organizing, enhanced collaboration, policy innovation, leveraging partnerships and resources, and changing the narrative. 5 years into building healthy communities, they're all important. But the 3 that are absolutely critical are people power and youth leadership and changing the narrative. I think the other 2 are important. I don't want to minimize that, but without moving forward and changing in terms of when we think about transformation in community, we cannot be afraid to talk about civic engagement in broader terms, because we know that there are power inequities that are in communities everywhere. And so how do we begin to call them out and look at power not so much as give and take, or this is mine, or this is how you get it, but how do we share power? How do we begin to understand the dynamics of power and privilege in communities? So when we think about these drivers of change, I've already mentioned what we call people power, but essentially it's really building the muscle, providing the technical assistance support, supporting nonprofit organizations that already have the capacity to begin to engage populations, whether it be undocumented, immigrant, LGBTQ youth, whatever population that is out there, to be able to engage and really bring them to the table. Youth leadership, I think this has really taught us an enormous lesson. We are leaving behind this generation that's been over-policed and really just sort of not considered as important in our society. Post-Columbine, we've seen a bunch of zero-tolerance policies, and we're now beginning to see sort of this momentous change and awareness of what's happening to our youth. So again, through our place-based efforts, we've really learned from community and heard from them that investing in youth, in opportunity, is absolutely essential in building their leadership development. Partnerships. I will say partnerships has been extremely challenging. Partnership, when we went out to do this work, it was the economic downturn. And many in communities of color were distrusted financial institutions. You had the worst mortgage crisis happening and impacting community, tearing communities apart. So the trust of systems was a really heavy lift for us, and really recognizing and also being humbled by the tsunami and the feel of community around post-traumatic stress and stress dealing with systems, what community calls systems of oppression. It could be as simple as a mother wanting to attend a PTA meeting, yet there is no interpreter in Khmer so that the parent is able to participate in that meeting. Or it could be a young person walking down the street and then is stopped by local police every day as they walk from home to school. So these systems, when multiplied, have an enormous impact. So we've learned a lot in that space, and happy to answer some questions in related to that. Changing the narrative. We know that when you think about any community in California, or even outside of California, in the nation, if you think of Detroit, you think of the Bronx, you think of, Oakland, you think of South LA, immediately what comes to mind is a particular image of that community. And so we feel that it's incredibly important to change that narrative of communities of resiliency and community of innovation. And I have to say, what we're learning is quite a bit of innovation in this space. So when we think about the goals in terms of how we see sort of the drivers of change playing out, we see that resident organizing, training activities, really creating space for local systems and institutions to fully engage participants. We know that when government works well, it works well for everybody and not just low-income communities. And part of the challenge that communities come up with is that when they are asked to respond either to a transportation plan, affordable housing plan, budget issues, sometimes they're usually in the form of a charrette or a big community meeting, and that's not enough. It's just not enough. What we've learned and heard from community, that there needs to be better engagement of community over the long haul, and there needs to be a report back. And we've seen multiple changes happen when systems really move in terms of creating these authentic processes to happen. When we think about the youth development and leadership development, We funded a study through a professor's department out at UC, she's now at UC Santa Barbara, Veronica Triquez, looking at youth leadership development, a longitudinal study. And the initial findings over the 5 years are that when young people are involved with health equity campaigns, and the health equity campaign could be as easy as water in schools, because we know that some schools have lead pipes in school, so the health equity campaign could be focusing on just water in schools, or it could be around school climate, quality of food in schools, a huge issue for young people, and safety issues. That when young people are involved with issues that they care about, if you look at the indicators in terms of how they feel about themselves and the sense of opportunity, and you look at it over time, and again, this study is only 5 years in, is that kids are finishing high school, they're going on to college, they have dreams. And I'm not talking about cherry picking any kid. We're talking about kids as a whole that are dealing with a number of these community issues. As I mentioned, changing the narrative, we see that at the foundation there are things that we can do to help shape that narrative, but we think it's actually more powerful when young people and residents tell their own story, and when they're able to sort of weave their narrative into prevention, into health equity campaigns that are more inclusive, it goes a long ways. I'll just say I'm going to focus on just one specific example, so to elucidate why changing the narrative is so important. Many of our communities have asked us to fund polling data, and what we find over and over again is that generally in California, and this is probably true for the nation, people want good schools, they want opportunity for their children, and they think it's better to spend time, more money on prevention than fixing the problems of tomorrow. But if you look at where our tax dollars go, our priorities don't often line up with our values. For example, take spending on prisons versus school. We spend in California $62K a year per person in prison for a nonviolent offense, like shoplifting or drug possession, but we spend $9,100 per year per student in our K through 12 schools. So at the California Endowment, this is one campaign that, yes, we did help develop, but it was really inspired by our Building Healthy Community sites to increase the awareness of public spending on priorities and how disconnected they are to health, safety, prevention, to support all Californians. So as a result of the change in the narrative, several pieces and collateral were developed, to really simply get the message across around spending per inmate and what it would cost to send children to preschool, or what would it mean to hold somebody per year an inmate versus sending children to a space camp. And then we started talking about what else we could do in terms of this. What would it mean to spend $120K a year to keep a child in prison, or provide a year-long mentoring program to 84 kids? So you get a sense of this particular campaign. What we found is that the campaign, as simple as it was, really resonated quite a bit throughout California, and many nonprofit groups just sort of taking this messaging up. The message of investing in youth and investing in low-income kids is one that is the gift that keeps giving, if you will. So how do we get this work done at the California Endowment, and how do we fund it? How do we support it? One is that we fund in these 14 communities what we're calling the Hub Collaborative. And the collaborative has many functions and structures and goals, but at the root of it, it's really that table of residents, young people, systems leaders, as well as other stakeholders to come to the table to really identify and work on priorities that they feel that are most important to them. I have to tell you, this is the really, really hard work. It sounds really easy. It sounds really great. It's really hard. And it's hard because of, as I mentioned already, distrust, not only distrust of systems leaders, but distrust of sometimes nonprofit leaders, gatekeepers, and it takes a lot of time. So time, if I can recommend anything, is time that communities need to be fully engaged, to have that space to talk about these issues is critically important. The other is support around learning and evaluation. I cannot tell you how hungry community is for data and information that helps them focus on what policies and systems changes that are needed, but data that's relevant, data that really points to where they can have an inflection point in terms of changing the tide, whether it be in local control funding formula, school funding, shifting it from local police and school to restorative justice, understanding budgets when it comes from here in California. We have Prop 47, which really changed our sentencing laws that will then hopefully have a windfall in terms of dollars that can be prioritized towards mental health, substance abuse, housing, and treatment. Communities want to know how that money is spent. Where is it? How do they advocate for those fundings and how to support community structures to happen? So again, this hub collaborative, as I mentioned, is something that we've learned quite a bit about. There's a big need to support this. So if we see this, we're supporting hub structures throughout California. And as we're doing this, intentfully connecting communities together, because there is a deep desire for communities to learn from each other in terms of strategies and tactics. So the other second takeaway is, how do you create and support learning communities? Learning communities where they can share those tactics, and sometimes they need systems leaders to be out of the room. Sometimes they just need to be alone and to talk about quite directly what they're learning in that process is very critical. So the next is, what is it about the local progress and changes? What you see up in this slide, we sort of organize our work, and health happens in schools, neighborhoods, and prevention. These are just the top line policy issues that community has identified to focus their efforts on over this 10-year window period that we have to work with them. So policy and systems change can be achieved through collaboration and power. The majority of our funding, as I mentioned earlier, goes to addressing those policy and systems changes that community sees as critically important to change. We know that as a health funder, and even though we're spending $1 billion over 10 years, if you think of that in terms of what the state spends every day, it's budget dust. It really is insufficient dollars to be able to move the needle. Early data that we're obtaining from our partners at USC is that when you engage community and provide them the technical assistance support and training of lifting community voice, residents are engaging local government agencies. So again, creating and animating that civic space. They're connecting with each other. They also are connecting with boards and commissions and understanding that either local county, city, or statewide commissions are critically important to addressing systems change, schools, state legislature, school district. So this gives you a real sense of how residents of the Building Healthy Communities work is engaging systems. And this is one community in City Heights, which is probably about an hour drive south from Irvine. A very mixed community, high African immigrant community, Latino community, Asian community, low income. And the priorities that they focused on primarily is restorative justice. There were stories that were coming out from the youth organizing that riding your skateboard was a $250 ticket for young people. And what they found is that it was disproportionately applied in some communities versus others. So it became an indicator to the school to prison pipeline for young people. So they identified the need to address skateboarding and create skate parks. Their big win is that they were able to leverage over $3 to $4 million in 2 new skate parks in their community to get the mayor and city council to support and provide other supportive services for young people. The other big win that they got is, as I mentioned, there's a large African immigrant. The issue of hunger in schools and food insecurity was large. So the Latino parents, along with the Asian and African parents, came together to really push for a halal menu, and they were able to successfully advocate that. Again, the school to prison pipeline, Parks for All, sorry about that. In Fresno, Central California, the big need there was park space, and they were able to achieve a really big win to be able to get investment in parks in low-income communities. So they ran, we supported them with data and information, communication support, and they were able to leverage all of that to get not only one park, but also a soccer park, plus raise the profile of the importance of safe places for young people. I'm going to zip through the rest of them because I think I'm out of time now. The School Climate Bill of Rights was enormous. I think the big takeaway from this graph and the next graph that I'm going to show you is that based on our investments across the 14 communities, there was this common theme around keeping kids in school. And so as a result, several local campaigns ramped up to address the school to prison pipeline. So if you just begin to look at suspensions in California, we begin to see a decrease, which from 2012 to 2014, an enormous down, willful defiance going down, and suspensions overall. We also looked and compared at our Building Healthy Community sites versus other communities across California that did not have the investment that we have, and we begin to see that there is an enormous reduction. So we see indicators that this investment is working. Lastly, when we see these statewide changes across community, we see these dramatic drop in difference. We've also seen that we've had local changes in schools and really shifting school dollars for restorative justice, to address chronic absenteeism, to provide healthcare services in schools. We also have the statewide changes that were made that resulted from community change. Willful defiance, if you're not familiar with that, if you have, say, for example, a child that's had a really rough day, or, came into school and, something happened to them. They were either stopped by a gang or something something was going on with them. They can come into the room a little bit fidgety. A teacher can kick them out of school, and then they're off to this school to prison pipeline. So communities identified that policy as one that was critically important to keep young people in school. The key findings that we're obtaining already from this survey, from this data and work that we're supporting, is that the Building Healthy Communities is really supporting the community organizing effort. It's working with immigrants, undocumented, parents of children in schools, young men and women, formerly incarcerated, LGBTQ individuals, and that it does make a difference from their point of view, that providing support and capacity building support for collaboration matters. I think the key takeaways in terms of thinking about research recommendations is that why is leadership and capacity building important? And what we're learning is that communities are organized and want to be recognized as partners with expertise and experience in building resilience, rather than as clients and beneficiaries of projects. Communities are dealing with localized, recurrent, everyday disasters that are the results of persistent poverty, environmental degradation, social marginalization, and other factors unrelated to natural hazards. Community leaders not only build resilience at the local level, but can also contribute as experts to policy making. And I'll leave you with these two quotes. "Not everything that is faced can be changed, but nothing can be changed until it is faced." The most common way people give up their power is by thinking they don't have any. And I think by building that power and resiliency of community, It's the legacy that keeps giving over time. And the importance of funding that particular work, as well as funding research that looks at power differentials in communities and then how health equity campaigns can help address that. Investing in youth can make a difference over time. Thank you.